Did you know your eyes could be trying to warn you about a stroke, up to a month before it actually happens? It's true. And the scary part is, most people, especially older adults, completely miss the signs. They think it's just part of aging. But these early warnings? They can make all the difference between a full recovery and a life-altering disability. So, what if you could spot those warning signs in time? What if a few simple checks could actually help you prevent a stroke? Today, I'm going to walk you through 5 eye-related changes that neurologists watch for, signs that can appear up to 30 days before a stroke. These are real, medically observed indicators. And once you know them, you'll have a much better chance at protecting yourself, or someone you love. But first, let me introduce you to Patricia. Patricia was 67. Energetic, joyful, loved gardening and spending time with her grandkids. Just the kind of woman who lights up a room. For a few weeks, she started noticing little things with her vision. Her left eye would go a bit blurry from time to time. One pupil looked just a little different than the other when she was putting on makeup. And colors? They didn't pop like they used to. She thought, well, I'm getting older. Probably nothing. So she didn't mention it to her doctor. But just 28 days later, Patricia collapsed in her garden. She had suffered a massive stroke that left her unable to speak and paralyzed on her right side. Her neurologist later told the family, her eyes had been sending warning signals for weeks. Signals that, if caught in time, could have prevented the entire ordeal. So let's make sure you don't miss those signals. Here are the 5 critical changes in your eyes that could save your life. Number 1, sudden blurry vision in just one eye. Have you ever had brief moments where the vision in one eye suddenly goes blurry, then clears up again? Maybe it lasted 5 minutes. Maybe 10. And maybe you brushed it off as eye strain or fatigue. But here's the truth, that symptom is not something to ignore. Neurologists call this condition amaurosis fugax, and it means there could be a tiny blood clot temporarily blocking the artery that feeds your retina. Now why is that so important? Because the same kind of clot can easily travel to your brain and cause a full-blown stroke. Dr. Anthony Morrison, director of stroke research at Johns Hopkins, puts it like this. When a patient loses vision in one eye briefly, it's like the brain is sending a preview of what's about to happen. It's a warning telegram from your body. Let me tell you about Gerald. Gerald was 72, a retired school principal from Ohio. He'd been having short episodes of blurry vision in his right eye. They only lasted a few minutes at a time. He figured it was just his age catching up to him. Luckily, during a routine checkup, his ophthalmologist recognized the signs immediately. Tests revealed he had a serious blockage in his carotid artery, the major vessel that supplies blood to the brain. His doctor said he was likely days away from having a major stroke. Gerald later said, "Those blurry episodes were my body's way of screaming for help. I just didn't know how to listen." So what should you do if this happens? Call your doctor immediately. Don't wait. Use the term amaurosis fugax so your doctor knows you're not just talking about tired eyes. Keep a small notebook by your bed or in your kitchen. Write down. Oh, when it happens. Oh, which eye. Oh, how long it lasts. Oh, what you were doing when it started. And if you can't get in to see your doctor quickly, go to the emergency room. This is not something to wait and see about. Ask yourself, is putting it off worth risking your independence? Your ability to speak? To walk? To hug your grandkids? Number 2, subtle changes in pupil size or reaction. Here's another simple but powerful thing you can do. Right now, even before this video ends, take a look in the mirror. Are your pupils, the black circles in the middle of your eyes, the same size? If one looks larger or smaller than the other, or if they react differently to light, that could be a red flag. This condition is known as anisocoria, and neurologists at the American Stroke Association say it can be an early warning of serious pressure changes inside your brain. What causes it? Blood clots forming. Blood vessels starting to spasm. Areas of the brain beginning to lose proper blood flow. According to Dr. Melissa Chen, a vascular neurologist, unequal pupils are one of the most frequently overlooked signs in pre-stroke patients. But they often show up in the month leading up to an event. Shirley, a 70-year-old grandmother in Florida, experienced this firsthand. She was putting on her mascara one morning when she noticed her left pupil was slightly larger than the right. She mentioned it casually to her daughter, who happened to be a nurse. Her daughter immediately insisted she see a doctor. It turned out Shirley had dangerous narrowing in her carotid artery that required urgent treatment. She later said, "If my daughter hadn't noticed that, I wouldn't be here today. It seemed like such a tiny thing, just a small difference in my pupils, but it ended up saving my life." So what can you do? Check your pupils in the mirror once a week. Do it at the same time of day, with good lighting. Make sure both are roughly the same size. Shine a flashlight or phone light briefly and watch both pupils shrink. They should react together and evenly. If anything seems off, even slightly, write it down and call your doctor. Now let's talk about number 3, tiny yellow spots in the retina, something known as Hollenhorst plaques. Most people have never even heard of them, and that's the scary part. These tiny yellow spots are often overlooked, even during regular eye exams. But make no mistake, they are major red flags that something's seriously wrong with your arteries. Here's the science behind it. Hollenhorst plaques are little fragments of cholesterol that have broken off from inside your arteries and ended up in the small blood vessels of your eye. It's like your eyes are catching the first signs of dangerous plaque that could soon block blood flow to your brain. A landmark study published in the New England Journal of Medicine found that 80% of patients who had Hollenhorst plaques visible in their eyes went on to suffer a stroke within 30 days, if no action was taken. Let's take a look at Richard's story. Richard was a 74-year-old retired engineer, healthy, active, never smoked a day in his life. He went in for a routine eye exam, no symptoms, just his yearly checkup. His optometrist noticed those classic yellow dots in his retina and referred him to a specialist immediately. Turns out, Richard had severe carotid artery disease. Within hours, he was in the hospital getting life-saving treatment. He later said, "I had no headaches, no dizziness, absolutely nothing to suggest something was wrong. If it weren't for those yellow spots, I would have never known." So, what should you do? Step 1, make an appointment for a comprehensive eye exam. Ask specifically for a dilated retinal exam. This is the one that allows doctors to actually see the back of your eye where these plaques show up. And when you call to book, don't just ask for a checkup. Say this, "I'd like to be checked for Hollenhorst plaques due to stroke risk factors." Not every optometrist checks for this routinely, so you've got to advocate for yourself. If these plaques are found, do not wait weeks. Ask for an urgent referral to a vascular specialist. Time is of the essence. Alright, on to number 4, a sudden curtain or shadow across your vision. This one's alarming. Imagine reading a book and suddenly feeling like a shadow or curtain has dropped down over part of your vision. Then, just as quickly, it's gone. Many seniors chalk this up to just getting older, but this could be your body's final warning before a stroke. According to vascular neurologists at the Mayo Clinic, what you're experiencing here is something called retinal ischemia. That's when the blood flow to your retina is temporarily cut off. This is almost identical to what happens in an ischemic stroke, when blood flow to your brain is interrupted. Except this time, it's in your eye. Dr. William Harrison from the Mayo Clinic says, when someone describes a curtain or shadow effect in their vision, it's usually a sign of temporary blocked blood flow. That same blockage can soon occur in the brain. Dorothy, a 69-year-old retired teacher, experienced this exact warning. While reading one afternoon, she saw what looked like a shadow drift across the bottom half of her right eye. It lasted maybe 30 seconds. She brushed it off, who wouldn't? 2 days later, it happened again, and her husband insisted she get checked. Doctors found critically narrowed arteries, and she was admitted for emergency care. They told her she was likely days away from a life-changing stroke. Her words were chilling, "That little shadow saved my life." So please, if you notice this curtain or shadow effect, even once, don't wait. Write down the time it happened, which I was affected, and how long it lasted. Then go straight to the emergency room and say this clearly. "I experienced a curtain-like shadow across my vision and I'm concerned about a TIA or impending stroke." You don't want to wait for a second episode, the first might be the only warning you get. And now, we've come to number 5, changes in how you see colors. Has the world around you seemed a little more dull lately? Are certain colors harder to tell apart than before, maybe blues and greens, or reds and oranges? While this might seem like a normal part of aging, it can actually be an early sign of stroke. Research from the Stroke Prevention Research Unit at Oxford University found that changes in color perception often appear up to a full month before a stroke. In fact, nearly 78% of patients in the study reported difficulty seeing colors clearly, often in very subtle ways. Dr. Elizabeth Warren, who led the research, explained, "These color vision changes are among the earliest neurological signs we've seen. They offer a rare window of time where we can intervene before a major stroke occurs." Let me tell you about Thomas. He's 73, an amateur painter for most of his life. One day, he noticed his paintings just didn't look right. He was mixing up colors that he used to recognize easily. He didn't think much of it until his wife noticed, too, his blue sky was looking strangely green. She insisted he get checked. An MRI revealed he'd already had several mini-strokes and was at critical risk for a major event. Thomas said, "I never thought color vision had anything to do with stroke risk. I thought it was just age." That assumption almost cost him his life. So what can you do? Grab a magazine or a colorful photo you're familiar with and look at it once a week. Ask yourself, do these colors look like I remember them? Can you easily distinguish between similar colors like red and orange or blue and green? If you notice any changes, don't ignore them. Call your doctor and say you're concerned about color perception changes as a pre-stroke symptom. Don't let anyone dismiss it as normal aging. Insist on a full neurological evaluation. To wrap this up, let's quickly recap the 5 early eye warnings of a potential stroke. 1. Sudden blurry vision in one eye. 2. Differences in pupil size or pupil reactivity. 3. Tiny yellow cholesterol spots in the retina, Hollenhorst plaques. 4. A curtain or shadow suddenly appearing across your vision. 5. A noticeable change in how you see or distinguish colors. None of these signs should ever be ignored. Your body has a remarkable way of trying to protect you, but only if you're paying attention. A quick mirror check, a routine eye exam, or simply noticing something off in your vision can be the very thing that saves your independence, your ability to speak, or even your life. So here's your call to action. If anything in this video sounded familiar, don't wait. Get checked. Talk to your doctor. And make sure your loved ones, especially those over 60, know about these warning signs too. If this video helped you, please like and subscribe for more vital health tips that could save a life. Leave a comment below. Have you or someone you know experienced any of these early signs? Let's help each other stay informed, stay healthy, and stay strong.